Let's begin with anorexia nervosa. Anorexia nervosa often involves severe restriction of food intake and an intense fear of weight gain. But anorexia is not simply strong willpower. It is a severe psychiatric illness in which restriction becomes reinforced by the brain. As the body becomes undernourished, the brain enters a survival state. Hormones and neurotransmitters begin shifting to conserve energy. Metabolism slows, sleep becomes disrupted, and anxiety may intensify. Over time, hunger cues can become blunted. The body adapts to starvation in ways that can make eating feel more difficult rather than easier. The brain is one of the most energy-demanding organs in the body. When fuel is chronically low, the brain must adapt. Research shows that severe anorexia can be associated with reductions in cortical thickness and subcortical brain volume. Regions involved in memory and learning, such as the hippocampus, may be affected. Executive functioning areas, including the prefrontal cortex, may also show changes. These changes can contribute to difficulty concentrating, reduced cognitive flexibility, and rigid thinking patterns. In other words, starvation can make the illness feel self-reinforcing. Bulimia nervosa involves cycles of binge eating, followed by compensatory behaviors. These may include vomiting, fasting, excessive exercise, or misuse of laxatives. Clinically, this pattern is often driven by a cycle of distress, loss of control, and shame. From a brain perspective, the binge-purge cycle can become reinforced through reward and stress pathways. Binge episodes may temporarily reduce distress by triggering dopamine-based reward signals. Afterward, shame and anxiety often increase. Compensatory behaviors may create a brief sense of relief. That temporary relief teaches the brain that the behavior reduces discomfort. Over time, the brain learns the pattern and urges can become stronger. Repeated purging behaviors can also create medical risk. Electrolyte imbalances can affect heart rhythm. Gastrointestinal injury can occur, and dental erosion is common with frequent vomiting. These risks increase when the cycle continues untreated. Binge eating disorder involves recurrent episodes of eating large amounts of food, accompanied by a sense of loss of control. This is not simply overeating. It is a clinical condition, often linked to stress regulation and reward processing. Episodes may occur in response to emotional stress, fatigue, or restrictive eating earlier in the day. In these moments, the brain is often seeking relief from distress. When stress becomes chronic, reward circuits may become highly responsive to immediate comfort. At the same time, the prefrontal cortex, responsible for impulse control, may struggle to regulate behavior during moments of intense distress. This imbalance can make urges feel urgent and overwhelming. Again, this is not a lack of willpower. It reflects dysregulation in brain systems responsible for reward and self-regulation. In the next video, we will explore treatment and recovery, because despite the seriousness of these conditions, effective care exists, and recovery is possible.